So we're here with Mirabelle today, and I'm just going to do a little treatment on it, but I want to explain a few things as we go through so that people at home understand what I'm trying to achieve and why we're doing what we're doing. Mirabelle, just tell us a little bit about your back pain. Where was it exactly?
So it's at the bottom right at more or less my sacroiliac joint.
Okay, so within the pelvis itself, you have the sacrum, which is the triangle bone at the base, and then on the right hand side where it meets this pelvic bone called the ilia, it's called the sacroiliac joint. And with women later on in pregnancies, they're releasing a hormone called relaxin, which makes the pelvis much more flexible, but unfortunately it can then also be more prone to injuries because it stretches too far. So I've got Mirabelle on her side because with the baby, you've got the heart and the main blood vessel coming down called the aorta. The baby is obviously going to be pressing down on that blood vessel as the blood vessel goes past, and mums later on in pregnancy find it very difficult sometimes to lie on their back for any amount of time. Mirabelle would probably be okay with a couple of minutes, but we don't want to actually have her there for an extended time because it's going to start to starve the uterus of oxygen. So Mirabelle, I'm just going to start to loosen up things just a little bit. Okay. One of the common things you're going to find with women later on in pregnancy is this area of the hip and just below the hip is quite cold, and it's because the circulation around this area is affected because of the baby. If you think about a baby being a mass within the tummy and all the blood vessels and lymphatic vessels are trying to get past and around the bump, it obviously then has a compromise. So women can get cramps later on in the pregnancy, they can get cold or pins and needles and numbness down the legs, and that's because of the structural influence from the baby affecting the low back and the pelvis and the circulation. Okay, so I'm just going to start with just starting to do a little bit of rocking, because